Okay, so this discussion is going to look at warm up and stretching. So we're going to begin our conversation just kind of talking about some of the general physiologic characteristics of warm up. And we're going to talk about stretching as well, more specifically kind of like how stretching should be used and how much what we consider just looking at stretching being incorporated into a warm up. So we're going to really look at like some activities that should really be included in a warm up and maybe how we should kind of look at incorporating pure stretching into it. Okay, so the benefits of a proper warm-up. So a lot of this is kind of key because obviously we're looking to accomplish specific things with a warm-up. Okay, so these are some of the physiologic characteristics when we're looking to warm up, and this kind of brings to light what we should really be doing as a part of a warm-up. Okay, so one, we want a faster contraction and relaxation of the agonist and antagonist muscles. So again, we're basically looking at the nervous system input to the active muscles and being able to teach the muscles contraction and relaxation properties as we're doing that. So we're basically prepping the muscles in that regard neurologically for the activities that we're going to be doing. Improvements in rate of force development and reaction time. Okay, so here again, we're just looking at, obviously we know that muscles during physical activity, if you think of all the different sports, things you do in training sessions, we need to work on the muscle's ability to not only produce force, but also produce it very quickly. Again, the warm-up kind of sets the stage for that. So we're basically looking here at another item that we're looking that's very important in preparation for the activity that's to come afterwards. Improvements in muscle strength and power. Again, this is just another efficiency thing. So again, these first three items kind of look a little bit as to how the nervous system works in activating our muscle activity. So you can see that, again, people typically just equate warm up with kind of like with flexibility training, and you can see with what we've talked about so far, we're looking to do a lot more than that with the particular warm up. A decrease in viscosity in soft tissue. So here we're just looking at kind of mobilizing the soft tissue a little bit. Again, we're not just simply looking at stretching or just trying to increase the flexibility, but we're trying to, as we go through the warm-up, to kind of take that connective tissue and just kind of increase the suppleness of it, if you will. Again, if you just kind of go from, for instance, sitting around doing nothing to trying to, say, sprint, you certainly could still do it, but optimally your tissue's not prepared for it. So our tissue has a certain degree of viscosity to it. So viscosity is a resistance to movement. Again, the best way to kind of make you understand what viscosity would be. So if you took a cup of water and a cup of honey and you dumped them both out, what would basically happen? Well, in the case of the water would just kind of spill out. The honey would gradually kind of fall out of the cup. That's because the honey has greater viscosity than water does, okay? So your tissues have a certain degree of that viscosity or resistance to movement. As you do a warm-up, if it's, done with the right types of activities, you gradually kind of decrease that viscosity and just kind of help with the suppleness of the tissue. Improved oxygen delivery. So we know that the oxygen delivery to the active tissues needs to be increased with this. Your textbook talks about how you get improved oxygen delivery due to the Bohr effect. So the higher temperatures that kind of develop as a result of the warm-up in the tissue just allows the oxygen to be delivered in a more efficient manner. Increased blood flow to muscles. So that would be an obvious part of the warm-up. So we're increasing blood flow to the active musculature. Again, that's going to help deliver, and that'll also help improve oxygen delivery to the muscles as well. Enhanced metabolic reactions. Okay, so your metabolism essentially is getting improved. So your body's able to use its energy substrates in a more efficient manner as a result of a warm-up. And increased psychological preparedness. So this kind of, we talked about the importance of psychology in sports and athletic activity. You have that here. Obviously, doing a warm-up and doing an active warm-up not only prepares you physically, but it prepares you psychologically for the activity that follows. So that's an important thing as well. So these are basically all of the effects we look at. Now here's another important point to note. So another thing I want you to be able to separate. So we obviously know when we warm up, we're basically looking to increase the overall core body temperature as a result of this. There are some warm-up effects that are temperature related, and there are some that are non-temperature related, okay? So the temperature related effects of a warm-up, in other words, these are things that happen as a result of the body temperature increasing. You get obviously an increase in muscle temperature, okay? So that's kind of obvious. If you're increasing the core temperature of the body, you're increasing muscle temperature. You get enhanced neural function. So the enhanced neural function, if you look at the first 3 points on here, those are all things that are related to the function of the nervous system. And you get disruption of the transient connective tissue bonds, okay? So that kind of goes to that decreased viscosity in tissue. So again, that would be another temperature-related effects. Your non-temperature related effects, okay? So these are non-temperature related effects, okay? So increased blood flow, increased elevation of baseline oxygen consumption, and post-activation potentiation, okay? Those are non-temperature related effects. So those are still important things to note as well, in addition to these kind of more general, this kind of general list of effects that you have with the warm-up. Okay, so looking at warm-up and static stretching. So, again, we know that in the past and even sometimes now, static stretching still tends to take up a good portion of the warm-up for individuals. So what we're looking at here is, again, research points to dynamic activity as being superior. Okay, so really in a warm-up, if you just think about the name, you're warming up the body. You're trying to increase core body temperature, which we said has specific effects. So in reality, we want to make sure that the warm-up is more movement-based, more dynamic, okay? Studies even go and show, and there's a plethora of evidence on this, static stretching has not been shown to reduce injuries. Okay, so that's an important point to note. So, a lot of times people say, well, we're stretching because we don't want to strain muscles. There's no evidence to show that that has taken place, and that's been studied and looked at extensively in research. There is no evidence showing that stretching reduces injuries. However, we do show that in a warm-up, you can improve performance after doing a warm-up for the body, okay? Now, that doesn't necessarily mean that you have to not include any stretching. I would say that just means you have to kind of limit and be more strategic with the stretches that you pick, okay? Another thing to look at is look at the sport requirements and look at what the athlete needs. So again, different positions on the field can have different requirements, okay, as far as what they may, specific areas of the body or specific movements that they need to warm up. So those are some things you want to be thinking about. You also do want to think about, well, what body parts do tend to get injured? Because again, those might be things that you specifically want to address in a warm-up. Again, not necessarily through stretching, but maybe through some other type of activity, okay? And again, as I said, you can include some static stretching. It's a matter of timing, okay? If your entire warm-up consists of a bunch of just, say, static stretches, you're actually potentially reducing power output in the upcoming activity. So you want to be mindful of that as you're selecting your activities. And again, if it's just a matter of thinking that you're going to prevent injuries in that manner, that's not really something that's going to take place. So the overall components of the warm-up, and the textbook kind of brings this up. First, you have the general warm-up, which typically should be around 5 to 10 minutes. Again, the idea with the general warm-up, again, these are some of the physical things you're looking to do. You're looking to increase the heart rate, you're looking at the blood flow increased, you're looking at deep muscle temperature increased, you're looking to increase your respiration rate, okay? So these are all some other things you're going to do. You're going to look to decrease viscosity in the joint fluids, and you're looking to basically decrease tension in the fascia and soft tissue, okay? So you're looking to kind of use that as kind of like your, again, think of the different things that would come both from directly warming up the body and indirectly warming up the body. Those would be things you're looking to do as a part of the general warm-up. Then as part of the specific warm-up, okay, that's where you start to look at, well, what are you warming up for? Okay, in other words, you want to look at the activity that you're progressing towards. So this would be where maybe you're doing like some sprint drills, for instance, if you're looking at doing speed work, okay? You're looking to incorporate maybe a little bit more dynamic stretching related to the movements that are going to be taking place. You're going to want to include jumping. Okay, in the case, like say you're doing a bunch of plyometrics afterwards, that would be the specific part of the warm-up. Okay, now, and ideally, the whole warm-up should last anywhere between about 10 to 20 minutes. That would be kind of a very general recommendation for the warm-up. It could possibly go a little bit longer. Again, you kind of have to ask yourself, how much time is overall allotted. Sometimes the sport coach is going to probably start to get a little concerned if the warm-up starts to impede too much on what they're doing. So, that's going to be something that practically you have to work out. And the other thing is that the warm-up should end no more than 15 minutes before the start of the primary activity. Okay, so in other words, after 15 minutes, whatever benefits you're getting from the warm-up, you're going to start to lose that as it gets further and further out. So the idea is you don't want to go through your whole warm-up and then wait a half hour and then go and do your activity. You're going to kind of lose some of those effects. Okay, so you want to make sure that the warm-up is done close enough to the activity that you're preparing for. Now, another way that is kind of discussed, and again, this comes out of your textbook, they utilize what's called the ramp protocol. So the ramp protocol just kind of shows, again, another categorization of activities that you're going to look to include in your warm-up, because ideally we're looking to kind of do multiple things across that general and specific warm-up as you're kind of going through. Okay, so ramp is actually a mnemonic. Okay, so the first idea is to raise. Okay, so again, this comes back to just that general elevating body temperature, raising the heart rate, increasing blood flow. Okay, getting that joint fluid viscosity down as a result of low intensity activities that just kind of help mobilize that, like for instance, that joint fluid, just kind of reducing the viscosity of it. So that's basically what you're doing during the raise portion of the warm-up. So you think of like low intensity activities that if you could kind of maybe like simulate some movement patterns, but again, you want it to be a gradual increase in the intensity of the activity. Activate and mobilize, that's actively moving through a range of motion, again, furthering the benefits of the increased tissue temperature and reduced tissue viscosity. You're looking to kind of now, work through some increases in the range of motion. And then the last part's to potentiate. Okay, so potentiation is just referring to a function of the nervous system. We're looking to perform some sport-specific activities that just kind of progress in intensity. Okay, so that's the other thing when you're constructing a warm-up, and this even goes beyond the potentiation activities, but you want it to be a gradual increase in intensity, because that's what you're doing. Okay, so I always tell students, like, start with low amplitude, low intensity activities and progress that through the warm-up, because that's going to show kind of a good gradual progression, allow some of those physiologic changes to kind of occur over the course of the activity. Now, looking at flexibility. So again, flexibility is important, but again, we're really talking about two separate things. And again, we also have to look at optimal flexibility. So not all athletes need to have the same levels of flexibility, okay? If you look at the two individuals in the picture, okay, the ranges of motion and the flexibility required for each of those sports is obviously not the same. And I have two very extreme examples on there, as you can see. But the take-home point is that you don't need to just increase flexibility and range of motion just for the sake of doing it. You want to kind of optimize the amount of flexibility that an individual has. Okay, so first of all, let's just define some things. So range of motion just looks like at the degree of freedom around a joint, okay? So range of motion just looks basically at how much motion is available at the joint, okay? Whereas we look at static versus dynamic flexibility. So static flexibility is basically the range of motion possible around the joint and surrounding muscles during a passive movement, okay? That's static flexibility, whereas dynamic flexibility is the available range of motion during active movements, okay? So dynamic flexibility requires voluntary muscle action, okay? And as a result of that, dynamic flexibility is greater than static, okay? And that's because of the fact that you're going to have active muscular contraction taking place. You're going to be having things that allow for greater range of motion. So dynamic flexibility is greater than static, okay? Static is going to be when you're moving passively. Dynamic is when you're going to be moving actively and requires voluntary movement, okay? Now, as far as, again, flexibility and performance, as I said, more flexibility doesn't necessarily mean that performance automatically is greater, okay? Again, the two individuals in the picture can be very successful at their given sport, but they obviously require degrees of flexibility and movement that are very different, okay? If the offensive lineman, as a matter of fact, were to have the degree of flexibility as the gymnast, that could actually potentially even cause problems. So again, you want to make sure, now again, offensive linemen need to be able to move and they need to be able to have motion, but obviously, again, we want to work towards what is necessary for the sport. And then we have many factors that affect flexibility, okay? Again, the book talks about these. I'm going to go through them here as well. So these are all different factors that affect flexibility. Joint structure is one of them. We know that we have different joints throughout the body that, kind of all have different ranges of motion. For instance, a hinge joint versus a ball and socket joint. Ball and socket joints have a much greater degree of range of motion and movement that takes place, so obviously that impacts it. So we have to look at joint structure. We have to look at age and sex, okay? Older individuals, for instance, tend to experience fibrosis in their tissues, particularly if they're sedentary later in life. So if they're inactive later in life, older people tend to lose some of that range of motion, flexibility in their tissues, okay? Regarding sex, females tend to be more flexible than males, okay? So that's another thing that kind of comes out as far as some differences, okay? Other factors, just the muscle and connective tissue in general. So muscles and connective tissue tend to have different levels of what we call elasticity versus plasticity. So that's going to influence the degree of flexibility as well. The stretch tolerance of muscles. So how much a muscle can actually tolerate stretch. So that's kind of an interesting point too, because stretch tolerance is actually typically what you're improving when you do classic static stretching. But that's something that's going to affect flexibility as well. Neural control, okay? The nervous system is going to impact how much flexibility is available as well. So it's not just the makeup of the tissue itself, but also the nervous system input that's going to affect it. So the effects of the central nervous system and peripheral nervous system are all going to impact flexibility. Resistance training, as long as you're resistance training with a full range of motion, that will help to improve flexibility. So flexibility and motion and anything that falls within that sort doesn't just have to be improved through stretching. As a matter of fact, sometimes the strength of the muscle can affect how far it's going to move as well. So resistance training with a full range of motion will influence flexibility positively. Muscle bulk is obviously another factor as well. I mean, if we just look at some joints in the body, if muscles are obviously bigger surrounding the joint, sometimes that will influence flexibility. And the last is activity level, okay? So again, I kind of mentioned this when we talked about age and sex, but activity level in general affects flexibility and how well you can move. The more active you are, the greater the tendency for you to be able to move better, and typically you're more flexible. Okay, so those are all the different factors that affect flexibility. Again, just to kind of run through them and summarize them. So joint structure, age and sex, muscle and connective tissue, stretch tolerance, neural control, resistance training, muscle bulk, and activity level. Those are all things. So again, flexibility is affected, which obviously will also influence range of motion, but it's affected by many different things, okay? That's why, again, sometimes simply just stretching all the time doesn't necessarily always improve flexibility in individuals.